By way of introduction, I'm going to welcome you to Physicians Regional Hospital here in Naples, Florida. My name is Robert Zehr. I'm an orthopedic surgeon. I've been here in Naples now for 12 years. I was part of the Cleveland Clinic when I first came down here. The last 3 years I've been in private practice, and I primarily focus on dealing with hip and knee replacements. So that's where the primary thrust of this talk will lead. And if you need more information about me in particular, please feel free to look up the webpage or any other piece of literature we have laid out over there. But suffice it to say, I've been in practice about 20 years now, and I like to do hips and knees. But more importantly, what we're going to focus on when we get started here is the concept of arthritis. One of the topics that never fails to lead to confusion is what arthritis actually might be. And so the first half of the talk is centered around helping you understand what arthritis is and how to stay away from guys like me in the operating room as best you can. So if that's a reasonable place to start, we're going to go ahead on through that. And arthritis is considered the #1 cause of disability in the United States every year. Far exceeds any problems with your heart, your back, your brain, diabetes. It's the #1 listed cause of disability. It affects about 1 person in 5. A disparate number of people live here in Florida. And not only that, this $1 trillion number seems to be thrown around with reckless impunity these days, but of the healthcare dollars spent in the United States, a sizable amount of it is spent on one diagnosis or a series of diagnoses that fall under the category of arthritis. So this indeed is a gigantic problem for all of us to deal with. Now, all of us kind of get amused when the government starts getting into medicine, but just to relay this little comic to you, as the government's new national health care coordinator, I've decided the treatment at your age just isn't cost effective. I'm sorry, but it's simply your time to go, Mom. And so when these things start coming up, it's in your best interest to pay attention when they start telling you who you're going to see and how they're going to treat you, and they don't have a little white coat with MD after their name. It's just not going to be in your best interest. So I'm presenting this information so that you understand what one of the biggest disabling disease processes that we deal with might actually be. There's actually 100 different variants of arthritis, and I can't begin to remember all of them, but essentially arth is the root for joint and itis is the suffix that means inflammation. And people don't quite understand what inflammation is, but they all do know that an inflamed joint leads to a great deal of pain. Inflammation in its purest sense is a triad of warmth, swelling, and redness. It leads to impaired function and decreased activity, in short, pain. And the most common forms of arthritis are the wear and tear osteoarthritis that the vast majority of you might have as you sit here. Rheumatoid arthritis is your own body attacking itself. It's called an autoimmune disease or an inflammatory arthritis. So gout, lupus, spondyloarthropathies all fall into this category of autoimmune, inflammatory, or rheumatoid arthritis. That's about 12% of people. Traumatic arthritis is what happens when you fall down, you break your knee into 100 pieces, and I've got to Humpty Dumpty it together for you, and it's not quite perfect. And those irregularities over many years wear the joint down, and we refer to that as traumatic arthritis. Another example of arthritis is septic arthritis. Now you might ask what that is. If you kneel down in your rose bed and drive a little thorn into the joint, and the little fungus ball in there starts to grow and causes a big infection, we call that septic arthritis. And that can happen, unfortunately, after a joint replacement, but it's typically seen in little kids and adults just from some puncture wound into the joint. We see it in the foot when you step on a nail, goes in the joint, you get some kind of an infection. So those are some of the common ones, but we're going to focus tonight on the most popular one, otherwise known as osteoarthritis. Now, when I look into a nice, young, healthy joint, this is what I see. This is a knee joint seen with an arthroscope. An arthroscope is a little television camera that we chase a lot of maladies in the knee, but this is the thigh bone. This is the shin bone, and this little kind of piece of material back here is called the meniscus. So when you have a nice, smooth, healthy joint, the lining of the joint is covered by this material called articular cartilage. It's extremely slippery. It's got a low coefficient of friction, and it's more slippery than ice by several hundred-fold. This is what tears when somebody says they've torn their meniscus. That's what they tear, but that's healthy looking. Now, it doesn't take a whole lot of experience looking at joints to appreciate that that doesn't look like that, right? That's a very worn out joint. The thickness of that white shiny surface is peeling away like paint on an old building. Shin bone's down here, this is the meniscus, and that's just wearing away. So I want you to think of arthritis in its simplest term is that arthritis is a wearing away of the shiny surface, just like you wear rubber away from a tire. If you think about it like that, it's not something that grows on the bone. It's not mold that you can scrape off your cheese. It's a wearing phenomenon, and as you wear that joint down, it starts to expose the bone, and as it does that, it starts to hurt and swell. X-rays. One of the ladies here asked me about an X-ray. The X-ray said my knee or my hip is bad, but I don't hurt. What about that? Here's an X-ray of a normal-looking hip. So we see a nice, smooth, round ball. We see a nice, smooth, round socket, and most importantly, you see that little space in there that the arrow is pointing to is that typical white, shiny surface I showed you on that previous slide. So that's a healthy-looking X-ray. Wouldn't expect that one to hurt. In contrast to that, we jump over here, and again, it doesn't take a whole lot of experience to say, wow, where's the space? You've rubbed away that shiny space. The two bones are grinding away on each other. You develop these little spikes that stick out the edges. Those are called bone spurs. And those are all signs of a seriously worn out joint. So the X-ray just tells me that the disease process is osteoarthritis. It in no way tells me, boy, you better get your operation done by X date or you'll be in real trouble. It doesn't work that way. This is merely a tool. It helps the doctor to decide what the disease process is. This isn't cancer, it's not a broken bone, it's not an infection. It merely is a worn out surface. Now, to get from here to there may take 5 to 10 years. It takes an incredibly long time. That particular hip actually went to surgery, and just to give you some idea what that looks like, that little ball bearing is that area there. And that's a very rubbed raw, bone exposed. Lots of nerves in bone. If you've ever broken a bone, you know when they rub together, they hurt. That's because there's nerves in there. And when you've got two raw, bony surfaces rubbing, that is painful. In a similar fashion, a knee X-ray is used to show, okay, that's a nice straight knee. The space between here is equal. You've not worn that down. That looks like a very happy looking knee. And in contrast to that, here's a knee where that interface is worn down. The little spurs are developing at the edges, and that's completely worn down. The other thing I always use this slide to point out is you appreciate how white that bone is. That tells me that there's a great deal more density in that bone than in the right-hand bone. Density has to do with how much calcium and other minerals that you have in your bone, and a healthy bone that's carrying weight normally looks like that. Now, why would that bone look a lot less white is because that person's walking off of that leg. When your leg hurts, you kind of walk like this. You get off of it. If you walk that way for many years and not stress the bone, your body will resorb that calcium and put it someplace else, or it flushes out to sea. So that bone is very porous. The term we use is osteoporotic, and that bone looks pretty dense. That's pretty normal, and you can do bone density studies to tell exactly what that is, but in qualitative terms, that's a fairly porous looking bone. So people tend to confuse osteoarthritis and osteoporosis, and I'm trying to clarify that osteo means bone, and porosity and arthritis don't have much to do with one another. You can have a very porous bone that looks like a normal joint, and vice versa, a dense bone that's very much worn. So don't confuse those two terms. This knee happened to go to surgery in a similar fashion as that hip you saw, and that surface you would expect it to hurt. Just look at how raw it is. It gets grooved and gets rubbed raw. You also develop these little spurs along the edge called osteophytes or bone spurs, as I mentioned previously, and that's what these are on the X-ray. So that surface is worn. This surface, not so bad. That still looks like a pretty decent, healthy lateral or outside part of that knee joint. But that one went to surgery, and that's what it looks like. Now, the next topic that applies to arthritis is how in the heck did I get this? Where did it come from? What is the etiology? And there are a number of risk factors, but in short terms, we really do not know. We know that it's a disease process that affects older people. 50 on up is more typical. The arthritis that we see in very young people, juvenile rheumatoid arthritis, for instance, is not all that common. It's debilitating to the children involved, but the wear and tear arthritis afflicts the 50 and on up crowd. Women, gender tend to be a women problem, meaning that 2/3 of the arthritic cases in the country are afflicting women more than men. And I mentioned in the previous discussion here that of all the knee replacements done in the United States, 60% are done in women, 40% are done in men. So it's a little bit more of a problem for ladies. Genetic, we all kind of know family members. Grandma had arthritis, mom had arthritis, I got arthritis. It follows sporadically down the family tree. We've identified at least 4 genes that I'm aware of that have some affiliation. We just don't know what to do with these genes. We don't know how to manipulate them and prevent you from getting arthritis, but that is the wave of the future. Joint mechanics, what I mean by that is some people grow up to have kind of bowed legs. You'll see little kids walking with bowed legs, and they look like that when they're adults. The other mechanical problem is you break your thigh bone in a bunch of pieces. When you have a car wreck, we have to kind of put it back together. If we put it together and your legs turned out 10 or 15 degrees and you walk a little canted, you will wear out the joint quicker. The joints above and below your knee, your hip, and your foot have to absorb all those extra stresses. So joint mechanics play a role. Now we're going to get to the nuts and bolts of things here. None of these do you have any control over. Sadly, we all have control over that, and I'm as guilty as the next person, so I'm going to include myself in there. But if you don't get that joke, lady looking for a little lost dog, that's a problem, okay? So we're going to spend some time on that because all of us probably are guilty of this to some degree or another.